When I was like 9, I was at the playground with my mom and she jumped off the swing and her arms got caught in those chains of the swing and she flipped over and she landed right on the top of her head and she broke her neck.
It's so interesting too how you said before dizziness and other things can be coming from the eyes, the ears, and the jaw. But how fascinating is when you give a precise neck correction that it almost makes all those symptoms function and work better. So people can come in with TMJ, they can come in with eustachian tube dysfunction, double vision, blurry vision, and you give them a neck adjustment and all those symptoms start to work and synchronize better and clear up a lot of those symptoms as well. Welcome, everyone, to a new episode of the Expect Miracles podcast. Today's episode is sponsored by uccnearme.com. Find an upper cervical chiropractor near you on uccnearme.com. Today, we have a very special guest, Dr. Jeff Clark out of the Path Chiropractic in Seattle, Washington. Very solid upper cervical doctor. We're going to go over some really interesting stuff here today that's not really talked about. Sometimes it can be very difficult to find information on this. We're going to talk about hypermobility, EDS, dizziness, how it could be coming from the neck, the jaw, the ears, the eyes. And, a lot of people are scared to get their neck adjusted, and we're going to address some of those issues today. And we're going to also go over some 3D imaging guided care and some other things to help people suffering with some of these issues. So without further ado, please welcome Dr. Jeff Clark. Dr. Jeff, how are you today?
I'm doing well, man. Thanks for having me.
Of course. Jeff, upper cervical is a very specific field. Not too many people know about it. It's growing, obviously, but I always like to ask people, it's such a niche. How did you get into it? What made you want to become an upper cervical doctor?
Absolutely. Well, it kind of blends seamlessly right into the topics we're going to talk about today with hypermobility. When I was like 9, I was at the playground with my mom and she jumped off the swing and her arms got caught in those chains of the swing. And she flipped over and she landed right on the top of her head and she broke her neck.
No way. She
And
broke
so
her neck?
she broke her neck. And so, it was sort of subliminal for me, but I grew up watching her go through that whole journey of what that looks like. And what that looks like is a lot of chronic pain at first, stiffness, tension, all that. And it develops into all of these different symptoms over decades, where for her, it was like tingling in her hands. It was headaches. It was off balance and dizziness. It was, and she was on every medication under the sun. And so I sort of grew up watching this all play out and how as we got further and further away from that initial trauma, which was the neck fracture, we got more and more abstract with where these doctors said these symptoms were coming from. When first it was really obvious, oh, you have chronic neck pain. Well, you broke your neck, and of course the answer for that is, well, good luck, and here's a medication. And then as the years go on, it's like, well, you have chronic anxiety, you have insomnia issues, you have, like I said, tingling and numbness in your hands. And all of a sudden, these symptoms aren't necessarily getting related back to that initial injury. They're getting attributed to other things. And so we get so far away from that initial neck problem. And I think a lot of these symptoms get so far away from what's actually happening and where they're being caused from. And now she's just on a full list of medications. And basically her doctors are telling her, look, you're in pain management. This is only going to get worse. She ended up finding a chiropractor who did activator.
No.
And that doc gave her some relief, inspired me to go to school. She became my first patient in the clinic.
Nice.
And of course, based on her imaging, it's contraindicated to do rotational type of adjustments. So we couldn't do that. I was adjusting her full spine in other areas, 2-3 times a week. We were doing activator on her neck. We were getting slight improvements on the margins, but not a ton. And I took a upper cervical toggle class. And, I said, hey, well, can we try this with my mom? And, the clinic staff said, sure. So I'd say about 2 weeks went by with us doing this. And my mom would come in and she'd be like, please, Jeff, just crack my back like you used to. I just want those cracks because I walk out the office feeling better. And I said, let's just wait. And a few weeks go by. I'd adjusted her only a few times. She had been holding her alignment pretty well. And the symptoms started to drop off. The pain started to drop off. The sleep issues started to go away. And, she started to look at me, and it was a drive from where I grew up into Hayward, where I went to school at Life West. It's like a 30-40 minute drive. And I'll never forget when she said, the weirdest thing happened. I didn't have any pain driving over here, and pain was always a huge thing with her for driving. And so we kind of looked at each other and we were like, whoa, what's going on? This is different. And yeah, I didn't look back from there,
That
and so every time I go home, I adjust her, and it's awesome.
that is a hell of a story, man. I got goosebumps. It's so amazing how you witnessed your mom just probably suffering most days, and you were the one to give her first upper cervical adjustment, and it's life changing. And not only do you see it with your mom, but you have such a passion for it that I'm sure you're helping so many people out at your clinic in Seattle that I'm sure a lot of people are coming in with the same issues now.
Absolutely. Yep. It's what I see all the time now, and it's something that I think we're going to get into a little bit more, but it's so interesting with this hypermobility stuff in that traditionally these are red flags
Mm,
for adjusting people,
yeah.
right? And I think such an important thing to address for folks, it's like you said in your intro, is people are so afraid of getting their neck touched, of getting adjusted when they have this ligament laxity, this
Mm,
hypermobility situation. And so I think it's so important for people to realize that we are not just putting people on the table and ripping up their necks.
mhm.
There's a process, and it involves the imaging. For me, it involves, conferring with the radiologist. And I get a lot of these types of patients from, hypermobility inflammatory specialists that are sending me people for imaging
Mhm.
because we have the luxury of having the 3D imaging in our office. And then those patients, oftentimes, they become sort of trial runs for us. And I say, look, not only do you have, you know, jugular compression or whatever findings these providers are looking for when they send these patients to me, but you also have upper cervical misalignment.
Mhm.
And how is that impacting your central nervous system? The extensions of your spinal cord and your brainstem into that upper neck and that vital, vital area of nerves in your upper neck and your brainstem. And look, this bone is clearly shifted out of place. Just because you have hypermobility doesn't mean you can't have restriction in a specific area, doesn't mean you can't have abnormal feedback in a specific area from that misalignment and that restriction. So let's see what happens when we do a very low force adjustment, keeping your head in neutral the whole time. We're not twisting, we're not cracking, we're not bringing those ligaments past their normal range of motion. And let's do a trial run and let's see what happens. And very often with these patients, we get great results quickly.
Exactly. And so, Jeff, we kind of jumped into this a little bit, but there are a couple different avenues with hypermobility. Sometimes it can be congenital, like Ehlers-Danlos syndrome. Sometimes it could be through trauma, like what happened with your mom. What do you know about Ehlers-Danlos syndrome and the patients you treat and symptoms? It could also be looped in with POTS, things like that. What do you know about Ehlers-Danlos syndrome?
Yeah, I mean, you're right in that there's a genetic component. But the interesting part about Ehlers-Danlos is that they don't actually know what the genes are.
Mm.
So they're searching in your genome for what they say is a genetic condition. As far as I understand, there aren't known, you know, genetic mutations that they've actually found. And so what I would say to the genetic component is, yes, we see it familially present, right? And I guess my question to that would be more so how much of the lifestyle component
Mm.
is involved with this. Obviously, if you have a traumatic injury to your neck, easiest way to, create ligament laxity. But I think that this is a field that's not very well understood.
Mhm.
They're trying to find the exact mechanisms of this. And as you said, with Ehlers-Danlos, this is a condition that they found over 60% of these patients, they also have recurrent types of infections,
Mm.
right? And up to 70% of these patients have these POTS type symptoms,
Mhm.
right? Which is basically when you stand up, you get this heart rate spike. And that's another thing they don't know exactly the mechanism of what's causing this. So when you sort of take a step back and you look at all these conditions together, you're kind of seeing, okay, you have a slew of conditions that aren't exactly explained in terms of how they're being caused. They don't have obvious genetic links, although we see them within family lines. And so that sort of speaks to me, okay, this is very likely there's a large lifestyle component here in terms of toxicity that you're getting from a young age, and in terms of the systemic inflammatory components that are probably coming through diet. You can look, there's so many different ways to look at this, but there's a dopamine response where you're scrolling on your phone, you're in bad posture, you're eating bad food, and the amount of reactions that are happening over time, even in your first couple decades of life, and it can severely weaken, the resilience of your body as a whole. And now you get in a minor car accident, you get in a little fender bender, you get this neck misalignment, and maybe that's the thing that pushes you over the edge into these, constant flare-ups and issues. So I think that it's clearly a multifactorial issue. It's an issue that isn't super well understood, but the way that I've had success with treating it is, you have to have a team of specialists that understand what the heck's going on with this.
Of course.
And for me, it's, hey, let's make sure they're on the right diet path. Let's make sure they're getting the right exercise plans going down. And then if we need to follow up with MRIs and other types of treatments, we can do that.
Perfect. Now, what are some of the symptoms these people with hypermobility presenting with? And what would you say the gold standard is for getting the diagnosis definitively that, yes, I have the hypermobility?
Yeah, that's a good question. I mean, the most common things you'll see with this are people describe that they have flare-ups, right? And that tends to be when they have stress in their life, whether it's mental, emotional, physical, whatever. And so they get these pain flare-ups that tend to look like fibromyalgia-like patterns, where you get like shoulder pain, you get ankle pain, you get knee pain, you probably get neck pain. Headaches are very, very common with this. The pot stuff we talked about, right? So when you go and change position, you might get dizzy, you might get tunnel vision, and you probably generally feel a little bit off balance, just when you're walking and going through your daily life. And then, people will come in and they'll say, watch this, look how far I can bend my finger back, stuff like that. So that's kind of the thing that maybe the, general person's a little bit more familiar with. But you see these clusters of symptoms again and again and again. And it's oftentimes, like I said, it's the headaches, it's the neck pain. They might have ear fullness, they might have jaw pain, clicking, popping, all that stuff. So there's sort of a general presentation of looseness in their joints, and then very easily like injured. And these people will often describe themselves as like, I'm just so fragile. I go and pick something up and then I'm hurt, I'm down, I'm in bed, and it takes me days to recover. And so that's typically what we'll see with this.
Now, and as far as imaging goes, somebody says, I have all these symptoms. How do I find out if I do have the actual hypermobility? I want to confirm it.
Yeah, so I think as far as I understand, the gold standard would be like flexion extension films to take a look at, okay, what's going on with movement with these bones? Are they completely moving past where you'd normally expect them to be able to, with normal strength and ligaments? But I think also a little bit of it plays into what we were talking about at the beginning, which is there aren't great definitive diagnoses for most of these conditions. And so most of these people are walking around thinking, I think I have hypermobility, I think I have POTS, but I'm not sure. And it's tends to be a real pain to go through all these steps, get all these bunches of tests. Many of them come back completely normal. There's a few kind of loosely linked markers that may be there, may not be. And so it's hard to get a definitive diagnosis. But I would also argue that, especially with the way that we're adjusting people, I'm not always chasing those diagnoses either. I'm sort of saying, look, you have a general presentation that looks like these conditions. We don't even really know what's causing these conditions or what the best way to treat them is. So I could slap 5, 10 labels on you. Doesn't really change how I'm going to treat them. Doesn't really
That's
change
correct.
the steps that I'm going to push them through of kind of where they should go next and all that.
So it's one thing to have hypermobility in your knees and your elbows. People come in and their elbows hanging off.
Yeah.
What is the biggest problem with having hypermobility, ligament laxity in that what we call the cranio-cervical junction? Why is that so devastating, causing so many symptoms in so many people?
Yeah. I mean, I think the first part of it is you're talking about a region that already has some of the most motion in your entire spine and is kind of set up to be one of the most unstable areas in your body, just based on the fact that you've got this big old head and this tiny little bone supporting it. Right. So anytime that you have a whiplash or a car accident, sports injury, anything like that, you're probably already compromising that area.
Mm.
And now you throw in the additional factor of you have weakened ligaments. Well, now you're in a lot of trouble, and you might just step off a curb wrong, turn your head wrong real quick, and you could have misalignment issue. And then all of the structures that are going on around those top bones of your neck, right? We're talking about the spinal cord, almost every single nerve in your body going between these top two bones. We're talking about blood flow and how they're going literally between the bones of your upper neck and right to the sides of them on the outside, around everywhere, right? And when you look at all the nerves that come out of that top area of your neck, I mean, it's unbelievable. So we see the nerves that go up into the head, into your jaw, into your face, all of that. And then, of course, when it comes to dizziness, a huge factor of dizziness is kind of like you prepped it. Dizziness is either involving your eyes, your ears, your jaw, or your upper neck. And very often it's all of those. And, my protocol for dizziness has always been, have you been to an ENT? Have you got your eyes checked? What's your status with the dentist? What do they think about those other areas? And most of the time we're a last resort for people, right? So they've probably been to specialists for that, who's probably cleared them and said it's relatively normal. And then the last thing hanging out is the upper neck that likely hasn't been checked out. And the role of the upper neck with dizziness is it's constantly sending input to your brain about where your head is in space and how quickly it's moving, right? And if that information is messed up, right? If you're getting bad information from your neck about where your head is in space, that image of where you actually are is off and it's distorted. And now it's really hard for my brain to make a plan of even walking down the hallway if I can't really figure out where my head is. And how often do you see these people, their head is not in a good position. It's tilted, their shoulders up, right? And they're saying, man, my shoulder is so tight. And you're looking at them and you're like, look at how all this has closed down. And it's a clear, miscommunication between neck and brain. And so for us, if we can basically improve the motion of those joints, improve the feedback from neck to brain, it should recalibrate them a little bit of, okay, now I feel like I actually know where I am in space and I can create a plan of how to walk without having to hold on to the wall.
It's so interesting too how you said before dizziness and other things can be coming from the eyes, the ears, and the jaw. But how fascinating is when you give a precise neck correction that it almost makes all those symptoms function and work better. So people can come in with TMJ, they can come in with eustachian tube dysfunction, double vision, blurry vision, and you give them a neck adjustment and all those symptoms start to work and synchronize better and clear up a lot of those symptoms as well.
Absolutely. People describe the flushing feeling or all that. And, that's such a common thing I'll see. The jaw clicking, the ear fullness, and all that stuff sort of balances out and recalibrates with those other systems because those systems are so taxed and overloaded. They're trying to compensate for the dysfunction going on in your neck. And when you fix all that, it tends to bring those systems back into equilibrium. And it tends to work a lot better when you've already had those areas checked and those areas are sound. And now the only piece left is the neck.
Now, Dr. Jeff, what are your thoughts on, since we are on the topic of hypermobility, PRP, platelet-rich plasma, prolotherapy, ligament strengthening injections that are, pretty natural. They're taking your blood out, they're spinning it around to create platelets. It's not a foreign injection. What are your thoughts on PRP and prolotherapy and even stem cells?
Yeah, I definitely have some patients that have been through that. And for me, I kind of have been, I guess, developing a protocol over, this past year, which looks something like this. Chances are these types of people have been to a bunch of other specialists before they ever find their way into our upper cervical offices. So they've had a lot of these clues investigated and likely run into dead ends, right? And then you say, okay, I see clear evidence of misalignment in your neck. Let's start a trial. And for me, it looks like a month. And so I say, look, let's do a month of care and let's probably get you going on some neck strengthening stuff too. I think that's vital. If they're not doing some type of neck strengthening, which, I really like the Next Level tool. I just think it's just a really easy way to sort of make that happen. But anyways, I think that's critical because you really don't know what stability you could create if you don't at least try to
Mhm.
strengthen them muscularly, along with what we're doing with the alignment. But I kind of tell people this, look, I want to give it a month. And if I can't get you to hold your adjustment for at least a week straight,
Mhm.
I start to feel like you have hypermobility to the point that you just can't stay stable. And if you
Mhm.
can't stay stable for over a week, and you know this, the healing isn't going to happen to a point that it's consistent and it's going to get you long-term results.
Mhm.
And you end up with this sort of roller coaster ride of I'm out, I'm in, I'm out, I'm in. Got adjusted. I went to the store, I felt neck pain, and I'm out of alignment. And it's like, man, you really are pretty fragile. So in those types of cases, I start to think I'm not sure, you may need a little bit extra work, and that looks like when the Prolo and the PRP comes in. And then that type of stuff it could be multiple injections depending, over a period of time,
The case.
depending on how they feel that it's strengthening. So you work with these people as they're going through it. And do you think that you want to strengthen your ligaments when you're in a misaligned position? Absolutely
No
not.
way.
So
Yeah.
I make sure that they're in soon as possible before that first injection,
Yeah.
and then as soon as possible after the fact to check up on them.
Mhm.
But as far as I've seen, with a few of these cases that I've had, it has made significant difference. So I'm definitely a proponent of this.
Yeah, and I'm completely on board with you. Like, let's try the upper cervical first, because if you are able to hold your adjustments, first and foremost, you're going to be saving tens of thousands of dollars. Sometimes it's a very expensive procedure, and if we can stabilize the upper neck without it, let's do it. And then again, if you're not holding your adjustments, not much healing's taking place, then I agree with moving them on to it's a really good marriage, upper cervical and the PRP and prolotherapy working together, getting it aligned first, and then after to make sure the adjustments are holding. And, I think those people will do really, really well.
Absolutely. And I just wish that it was something, a big goal for me is just to increase the visibility of all of this stuff,
Yeah.
because the tendency for these people is they have completely slipped through the cracks of your traditional, you know, Western healthcare system, and they've basically been told, like, you should see a therapist, you know,
Yeah. It's all in your head.
this, you might be faking.
Yeah.
And so just bringing some of these people into your office, taking imaging, explaining it to them right away, and saying, actually, there might be something going on here that we can do something about, and it goes back to the diagnosis part that we talked about in the beginning. Like, yeah, I think it does help some when you've been diagnosed, but if there's no action steps after that, then you're still kind of in limbo.
Yeah.
And so I think people appreciate the fact that I can get them in quickly. We can start care relatively quickly compared to what they're used to. These people are waiting months and months for a consult to then get an
See your
MRI.
neurologist. Yeah.
So it's endless, the
Yeah.
waiting. And so I
Um,
think for us to just, yeah, go ahead.
And so, Jeff, I want to ask you, it's very interesting. The longer I'm doing the upper cervical work, when I started off in school shadowing a bunch of doctors that were doing it for a long time, it was like, don't move your neck. Be very careful with it. We don't want to do any
Yeah,
exercising or anything for 3 months. We want to let it stabilize. And the longer I do this work, the more I'm seeing how important movement and strength exercising is. And you're using Next Level, which it looks like I don't have it yet. I'm actually in the process of getting it. So my question for you is, how soon do you, like, obviously case by case basis, but you give somebody their first neck adjustment, or maybe they're under care for a week or two. When do you like to introduce the strength exercising with them?
yeah. I like to do the first adjustment, nothing else. Just
Mhm.
let them just see what they do with that. And then I'd say probably that second visit as well. I'm kind of just saying, look, let's adjust you, because you know how people are. I mean, it depends on the type of person you have. You either give someone exercise and they're never going to do it, or they're going to do it to the extreme. And it's like,
Yes.
whoa, whoa,
Yeah.
whoa, hey,
Yeah. Yeah.
chill for a second.
Yeah.
So I would say right around probably that 2 week mark for me is
Mhm.
when I start to feel more comfortable. I might tell them, like, hey, let's start working on some general movement,
Mhm.
especially extension, because we're just stuck in flexion
Mhm.
all the time at the desk. So I just say, hey, let's start getting comfortable, moving your head back here. What does that all feel like? Oh, yeah, it's not that scary. And then we can get into like next level type stuff, movement stuff. The reality is it's just kind of hard to strengthen your neck
Yeah.
compared to other muscles.
Absolutely. And I have a few patients that are either yoga practitioners or do a yoga practice. And I'm always like, after the first adjustment, don't do anything, just relax. And then they'll do
Yeah,
it. They'll do their yoga practice to do everything. And they come back and they're holding their adjustment. And so a lot of the people I see that have a good yoga practice or doing a couple times a week, they hold their adjustments really, really well, as opposed to the person that's just sitting at a desk, going home, sitting on the couch, coming back. I feel like those people don't hold as well as somebody that's moving and activating those neck muscles. I feel like they hold a lot longer and do better under care.
I agree. I agree. And especially for hypermobile folks, the fragility feeling is real. So I
Mm-hmm.
think, all the studies point to the fact that bed rest and sitting around doing nothing for hypermobility and these
Mm-hmm.
inflammatory conditions is a negative.
Yeah.
So I agree 100%. You need to be moving, low level mobility strengthening.
Mm-hmm.
Don't go and do, some kind of hit workout,
Yeah.
interval crazy
For
stuff.
sure. Yeah.
But yeah, get your body moving. And I think get into those deeper ranges of motion and just start getting comfortable with what really is your natural type of range of motion that you've
Yeah.
probably been avoiding for a long time.
Yeah. And especially with patients that used to be active, it's so debilitating and tough to maintain any active routine when you have the hypermobility. And then when you add on a layer of we're not going to do anything, any exercising for 1 to 3 months, that is so deflating on how already awful they're feeling. And they just want to do something. So introducing things slowly, lightly, going for more reps than brute strength, I feel like that's huge part of the healing process.
Absolutely. And to your point, I would rather have somebody push it too hard
Mm-hmm.
and basically take themselves out of alignment, and then
Yeah.
come in the next time and then we talk about it.
Yeah.
And I say, look, well, you did a shoulder press and you weren't
Yeah.
ready for it. And that's
Yeah.
okay. But if we don't keep pushing the envelope, we're not going to know. And for me, I'm like, let's get this train moving as fast as we can because
Mm-hmm.
chances are you've been stuck in the mud for years or decades with this. And so I'm very much of like, look, let's get out of this mindset that anything I do is going to hurt me. And let's get into the mindset of we're healing and we got to try different things and we got to see what works because everybody's going to be a little different with this. And so, yeah, I would rather have people, and I tell people all the time, like, go test it, go try it. If you feel good, go try it. And we can always readjust you. It's not an issue. But the whole point of this is to get you to a point that you can do what you want to do. The
Yeah.
point is not, let me get you aligned so you can sit in a coffin and not move for 20 years. Like, what's the
Right.
point of that?
Yeah. And anybody that wants to give Dr. Jeff a follow has a pretty great workout routine, like impressive workout routine. Sometimes you record your workouts. The full body control on some of your workouts is real impressive, Jeff. Is that something you've been into for a long time? Is that something you just got into or
I've always been into it. Before I was a chiropractor, I was a strength and conditioning coach.
did
Uh, yeah, yeah. So I worked with the Rockies for a little bit.
wow.
And so, yeah, so I've always been into movement, always been into strength training. And, you know, it's changed a lot how I've done it over the
Yeah.
years into sort of longevity
Yeah.
movement. But yeah, I mean, as much as I can, I preach that to all my patients and I found what works for me, and of course, I've had injuries and a lot of these
Mhm.
injuries come up with my patients. And I think it's truly night and day when you can get somebody following an exercise routine long term, what it does for their entire body, stress, all that.
Yeah.
And it's no different for hypermobile patients. You got to get these people moving and you got to get these people trusting that they can move without immediately being in pain.
For
And I
sure.
think just that level of empowerment for people is enough to get them back to being interested in movement and even in life. And it's like, look, if I told you anything you do is going to make it worse, then you're not going to do anything. So we have to, one of the biggest keys just overall is just reframing the story for these people and saying, look, you are currently living in this fragile lifestyle and we need to get you out of that because that's ultimately what's going to help you.
Agreed. And Jeff, at the end of each show, I'd like to ask all my guests, what is one piece of advice that has really resonated with you over the years that you would like to give the audience? Could be absolutely anything.
Piece of advice. I mean, I don't know. What you want to talk about hypermobility or just
No, anything in life in general, whatever you feel. It's a tough question. It does stump some people, but whatever you feel like sharing, that's on your mind or what you're feeling passionate about right now.
no, I got you. No, I mean, for me, the advice is like obviously I'm a pretty new business owner and there's a lot of money issues and a lot of things going around with all that and there's a lot of stress. But I always just boil it back down to the story I told in the very beginning of the show. And like, why are you doing it? What's
Mm,
important? And for me, the most important thing is that I can practice the way I want to practice and I can help the people that I want to help and I can make those connections with people. And
mm,
so I think like that brings me so much more joy and it just
absolutely.
is so much better for my life than really even worrying about the money. Like I think that stuff's going to come along in
Mm,
the end, but I just think, and I guess this is a little bit specific to chiropractors, but you have to find out what gives you passion and the niches like this because I'll just say as you surely have experienced, it's so easy to get bogged down as a healthcare provider or in any profession. You just get bogged down with the day to day.
mm,
And so you have to sort of take a step out and just be like, wow, not only am I blessed to be here, but I'm doing exactly what I want to do. So who cares about
mm.
the rest?
Yeah.
And, and then with social media, who cares about who's judging you? You got to just
Yeah.
post what you post and live by that.
I love that. And Dr. Jeff, where can people find you on social media and book an appointment with you at your practice?
Yeah, we got thepathchiro.com and we have the Path Chiro on Instagram, and we're super responsive on both.
Awesome. Awesome. Well, Jeff, this has been an awesome episode. I had no idea about your mom's story. That's amazing. And it just goes to show why you're doing it and the results you're getting. That's very powerful. I think people really resonate with that. And I would love to have you back on anytime, brother.
Let's do it.
All right, brother.